Hi, I'm Dr. Kristin Ball Motley, and as we celebrate the life and legacy of Dr. King in Chester and the surrounding community, I'd like to talk about the COVID-19 pandemic. This pandemic has had a devastating impact on each of us, on our families, on our communities, and we're not sure when this is going to end, but we do have some information that will help limit the impact. We need help to get these kids to stay in school so that your life isn't interrupted when schools go virtual. We need help to keep people out of the hospital so that healthcare workers can get a break that they deserve. And we need help getting our lives back to normal so that we can do the things that we love to do without worrying about catching COVID. So let's talk about how we can get our lives back to living like it's golden. It's two really important things that we can do. One is really easy. Wear a mask. Whenever you're out and about in stores and you're visiting family and friends, you're at work or wherever you go, make sure you have on a mask. Masks help protect you and they help keep people around you safe. The Omicron variant spreads much easier than other variants. And we know that cloth masks don't protect as well as N95 or surgical masks. So if you wear a cloth mask, just make sure you have one with a filter pocket so that you can add a filter that adds that extra level of protection. Now, I would avoid purchasing surgical and N95 masks from places like Amazon because there are so many counterfeits in the market. It's really hard to distinguish the real from the fake, and so just be careful where you buy your masks. Most pharmacies and stores are stocked with the surgical masks. They're not really expensive. A box of 50 may cost about $10 or so. And now it's not really easy to purchase an N95 mask from local stores, so I put a few links in the description for some reliable N95 mask vendors. Now, the second really important thing you can do is get vaccinated. This is not an easy decision for everyone, especially for people in the Black community. It was certainly not an easy decision for me. I waited about 6 months or so before I decided to get vaccinated. So if you haven't gotten vaccinated yet, I get it. I understand. This is due to the centuries of racism and unfair treatment toward Black people and Black communities. And for many of us, it's about fear and it's about trust. Fear of the unknown, right? It's just too new. Will the vaccine cause more harm? Will it hurt me later? And so those are questions that we need answers to. The good news is that these vaccines are not new. The mRNA vaccines were discovered over 30 years ago. They tested for it in other diseases like flu and rabies and Zika, and it just didn't offer more advantages than the vaccines we already have on the market. For instance, mRNA vaccines have to be stored at super low temperatures, requiring special expensive freezers. And vaccines for flu and rabies, they don't require those special storage requirements. So it didn't make sense to use mRNA vaccines for those diseases. Thankfully, when mRNA was studied for COVID, it worked. And although it required those special expensive freezers, it was well worth it because so many people were dying and so many people were getting sick. So the mRNA vaccines are not new. Now, they are new for COVID because COVID is a new disease, but they're not new in general. As for the J&J vaccine, the technology used to make it is definitely not new. They used that same technology for their Ebola vaccine, which was studied for years and improved in Europe even before the COVID-19 vaccine was approved. We know that vaccines are overwhelmingly safe. The risk of harm from the vaccine is extremely rare, but some people are worried about the long-term dangers, and I completely get that. That's understandable. The good thing is that in the history of vaccines, there's no evidence that problems pop up years down the road. It's never been a thing. We do know that getting COVID, the disease, can cause problems that still haven't gone away for people who were infected over 2 years ago. So based on what we know now, you should be more concerned about getting sick from COVID than about getting the vaccine. For other people, trust is playing a huge role in their decision. Some people don't like that the government is trying to push the vaccine on everyone. I get that. But one reason they want people to get vaccinated is because vaccinated people are less likely to end up in the hospital for COVID. Now, you may get sick if you have the vaccine, but you won't get sick enough to require a trip to the ER. From the government's perspective, people who are not vaccinated put a huge stress on the healthcare system when they end up in a hospital. It puts stress on healthcare workers, they have to work overtime, and it puts a financial strain on the government and insurance companies that have to pay for your hospital stay. This is very expensive. Can you imagine how much it costs when hundreds of thousands of people are in the hospital for days and for weeks due to COVID-19? And in many cases, the government is paying the bill. So yes, they want people to get vaccinated just because it just costs so much money. And some countries now are even taxing people who are not vaccinated. Now, other people don't trust the healthcare system and they don't trust the government. We don't have to go back as far as the Tuskegee experiment to understand why. We have seen with our own eyes and experienced in our own lives the unfair treatment of Black people by these establishments. I see why it's hard to trust these groups. However, this situation is different. COVID-19 is affecting everyone. Everybody's at risk of getting sick and dying, regardless of your race. With COVID-19, they can't draw lines to give themselves an advantage. They can't hold back funding to create better opportunities for themselves, and they can't make laws that work in their favor. We are all in this. We are all at risk, and no one race is going to get out of this by themselves. The same vaccines being offered in white communities are being offered in Black communities, Hispanic communities, Asian communities, and communities all over the country. No one is immune to this disease, and even though our history and experiences tell us to be cautious of the government and healthcare system, COVID-19 has set a level playing field. It is not racist, and one race will not get out of this alone. We all have to get out of this together. Now, some people don't trust pharmaceutical companies. They feel like they just want to make money off us. They don't really care about us. And one thing that I know for sure is that they do want to make money. But you have to realize they are a business. And if you had a business, you would want to make money too. We need these companies to make money because when they make money, they discover life-saving treatments for diabetes, for cancer, heart disease, and yes, for COVID-19. So who else is going to discover the vaccines if the drug companies don't? Now, there are some academic research centers working on this as well, but the big drug companies are the major players in this game. No, we don't feel good to hear stories about drug companies lying about the harmful effects of their drugs or overpricing medications and price gouging, making drugs unaffordable for people. But this pandemic is a very unique situation. Everyone has their eyes on the data, so any red flags will definitely come to light. I'm positive we are going to hear about it in the news if anything goes wrong. Drug companies will certainly make as much money as they can because what business wouldn't? So yes, they make money from the government when we get vaccinated, but at the same time, they discover the life-saving interventions that we need to survive, including the COVID-19 vaccines, and that's okay. Now for others, people don't want to be told what to do, and because of the long history of racism, which is still in play today, they do not believe the government has their best interest in mind. So if the government is telling you to do it, it can't be good for you, right? I get that too, but this is not about the government or anyone else telling you what to do. This is about you using factual information and making the decision to do it on your own. You can choose where to get vaccinated, you can choose which vaccine to get, and you can choose who will give it to you. So please realize that when you make a decision not to wear a mask and not to get vaccinated, your decision impacts everybody around you. Studies show that people with COVID-19 who are not vaccinated spread the disease to more people than those who are vaccinated. This is because people who have been vaccinated already have the antibodies or the protection to fight the virus as soon as they're exposed. The antibodies attack the viral particles, and that helps to keep a low number of virus circulating in the body, so it's not as easy to spread it to others. When you are not vaccinated and you get COVID-19, your body takes several days to make antibodies. And until that happens, you're spreading the virus to your friends, to your family, and anyone who's around you. If you have not been vaccinated and now decide to get vaccinated, you may feel like you're letting yourself down or you're letting down people who agree with your reasons not to get the vaccine. We all make decisions based on what we know. And as you learn more about the virus and the vaccines, your knowledge base changes. You can now make decisions based on that new information. For instance, we now know that the Omicron variant spreads easier than other variants. So if you didn't wear a mask in public before, you may consider wearing a mask now. That's okay. You change your decision based on the information you have now. We also make decisions on how we feel. Those feelings can change over time too, and that's okay. If you now decide to get vaccinated, it's fine. You don't have to uphold your position to prove a point to anybody. You owe it to yourself and you owe it to those who you love to make the best decision for you. The world's best scientists are working on getting us through this pandemic. Because of the achievements of Dr. King and all the progress he and countless others have made, many of those scientists are Black. They want the best for us. There's no better way to honor Dr. King and his legacy today than to do your part in keeping our community from getting sick, from going to the hospital, and from dying from COVID-19. That brings us back to those two things I spoke about in the beginning: wearing a mask and getting vaccinated. Fortunately, we are not in a country that doesn't have the infrastructure and resources to get vaccines to us. The vaccine is available, but you have to want it. You have to want to protect yourself, your children, your parents, your friends, your homies, your girls, your crew, and all those who matter to you. If you're ready and you want to find a vaccine location near you, I've put some links in the description. As we reflect on Dr. King's journey to ensuring equality for all, we have an opportunity to benefit from his work. We have a vaccine, the same vaccine that's being offered to everyone that will help keep us out of the hospital and keep us from dying of COVID-19, just like it will help people of all other races. And that is the equality that Dr. King dreamed about. Thank you so much for watching.